Okay, now you can hear it.
By the end of the second week of development, the bilaminate of the hypoblast and
I hope now you can hear.
Yes, sir.
Yes, sir.
Yes, sir.
Okay, so let's continue. There are 2 videos to watch. Please, this is explaining from week 2 to week 3. So please pay particular attention. Epiblast, hypoblast was week 2. Okay, so we are continuing from there.
epiblast has formed. Throughout the third week of development, this bilaminar disc differentiates to establish 3 primary germ layers in a process known as gastrulation. Around 15 days after fertilization, a thickened structure forms along the midline in the epiblast near the caudal end of the bilaminar embryonic disc. This is called the primitive streak. At this stage, the formation of the primitive streak defines the major body axes of the embryo, including the cranial end towards the head and caudal ends towards the tail, as well as the left and right sides of the embryo. At the cranial end of the embryonic disc, the primitive streak expands to create a primitive node which contains a circular depression, known as a primitive pit. This depression continues along the midline of the epiblast towards the caudal end of the streak, forming a primitive groove. Once formed, cells of the epiblast migrate inwards towards the streak, detach from the epiblast, and slip beneath it into the interior of the embryo. This process is known as invagination. The first cells to invaginate through the primitive groove invade the hypoblast and displace its cells. The hypoblast cells are eventually completely replaced by a new proximal cell layer, which is referred to as the definitive endoderm. By day 16, the majority of the hypoblast has been replaced. The remaining cells of the epiblast are now referred to as the ectoderm and forms the most exterior distal layer. Some of the invaginated epiblast cells remain in the space between the ectoderm and newly formed definitive endoderm. These cells form a germ layer known as the mesoderm. Once the formation of the definitive endoderm and mesoderm are complete, epiblast cells no longer migrate towards the primitive streak. Throughout gastrulation, the ectoderm continues to form from the cranial to the caudal end of the embryo, establishing 3 distinct primary germ layers throughout the whole embryonic disc. The gastrulation process is finally complete.
Okay, so this was gastrulation, moving from 2-layer to 3-layer, moving from epi and hypoblast to ectoderm, mesoderm, and endoderm. Okay, so I'll load this video to your page when we are done. Okay, the other videos were fertilization week 1 and 2, but week 3 videos like gastrulation and relation, I've not loaded them. Okay, so let's watch the relation. Now listen carefully before you watch that video. Gastrulation is changing from bilaminar to trilaminar, okay? But during that time, neurulation happens. So neurulation is not different, doesn't happen after gastrulation. They all happen at the same time, okay? So let's watch the second video for neurulation. Gastrulation is very simple. Let's watch the second one for neurulation.
The cranial end of the primitive streak forms an elevated.
So this is talking about how
the cranial end of
this video is talking about how the notochord is formed. Okay, so the formation of the notochord is what we call neurulation, and that comes together with gastrulation. Okay, gastrulation is when two layers are changing to three. At the same time, notochord is formed. Notochord is the primitive tendon that will form the spinal cord and the brain of the baby. So that forms very quickly, and it forms at the same time the layers are changing to be three. Okay, so let's get that one too.
The cranial end of the primitive streak forms an elevation, the primitive node or Hansen's node. Soon, a depression appears in the primitive node known as primitive pit. These cells from the primitive pit invaginate between the ectoderm and endoderm, migrates cranially, forming a solid cord of cells in the median plane known as the notochordal process. This extension is stopped by the precaudal plate, which is a small circular area of columnar endodermal cells, where the cells of ectoderm and endoderm are fused together. This cellular cord, which extends between the primitive node and the precaudal plate, is known as the notochordal process. Soon, the notochordal process is canalized to form the notochordal canal by the extension of the primitive pit into the notochordal process. The cells in the floor of the notochordal canal becomes intercalated with the underlying endodermal cells of the roof of yolk sac. The fused layers gradually degenerates in craniocaudal direction, results in the formation of openings in the floor of notochordal canal. Thus, the notochordal canal communicates with the yolk sac. Through the primitive pit, the notochordal canal also communicates with the amniotic cavity. Thus, a temporary communication between yolk sac and amniotic cavity is established. This communication ensures the nutrition to the ectodermal surface of germ disc till the formation of blood vessels. The remaining part of notochordal process becomes flattened and forms a flat plate of cells known as the notochordal plate. This notochordal plate gradually folds along its long axis and separates from the roof of the yolk sac, which is now lined by a continuous layer of endoderm. The cells of the notochordal plate begins to proliferate in the cranial caudal direction. These proliferating cells enfolds and forms a solid flexible cord of cells known as the definitive notochord. The notochord functions as primary inductor. It stimulates the development of primitive vertebral column, and it induces the overlying ectoderm to thicken and differentiate into neural tube. The notochord degenerates with the beginning of the formation of vertebral body. The remnants of notochord remains a nucleus pulposus of intervertebral disc and apical ligament of dens.
Let me undo all. Were you able to understand it?
No, sir.
No, sir.
No?
No,
Ah.
sir.
No, sir.
No, sir.
Hey, Adai.
No, sir. Sir, no, and tissue.
Ah,
Na yɛ ho no so.
ebi a one tia senkasa on tehwe. Ah,
Notocol nko a.
oh. Notocol nko na ote.
Highlight brofo.
Oh. Monya islet da.
Embacho debut.
Hey, monya ma se mo dwane ma ya de. Pa mo yi
Ya
right.
ya kwala da.
Obi andọ man no.
Eji degree ni di akọ.
Eh.
Wa karo.
Sai ka yeshe Chinese frame.
Okay, me say Bobby. Right. Now, Mami Chomu, all what I'm saying is this. I hope the first video you were able to understand it. Gasolation. Moving from 2 to 3. I hope that one was clear.
Yes, sir.
Yes, sir.
Good. So during that time that the invagination is happening, the cells that are going down there, they don't form mesoderm alone. They also form notochord. That's all what you are saying. So during gastrulation, you see there is an invagination, moving cells from the epiblast, going through the streak to form the mesoderm. The first cells that will go in the midline, they form the notochord. And the video about notochord is trying to tell you that process is called neurulation. So video, the last video that I played was trying to tell you actually what neurulation will do apart from that. So to talk about gastrulation, it also will talk about neurulation at the same time. Okay. So that's what the video was about. So now that I've explained it, watch it again and then let's start our lecture.
The cranial end of the primitive streak forms an elevation. The primitive node or Hansen's node. Soon, a depression appears in the primitive node known as primitive pit. These cells from the primitive pit invaginate between the ectoderm and endoderm, migrates cranially, forming a solid cord of cells in the median plane known as the notochordal process. This extension is stopped by the precaudal plate, which is a small circular area of columnar endodermal cells, where the cells of ectoderm and endoderm are fused together. This cellular cord, which extends between the primitive node and the precaudal plate, is known as the notochordal process. Soon, the notochordal process is canalized to form the notochordal canal by the extension of the primitive pit into the notochordal process. The cells in the floor of the notochordal canal becomes intercalated with the underlying endodermal cells of the roof of yolk sac. The fused layers gradually degenerates in craniocaudal direction, results in the formation of openings in the floor of notochordal canal. Thus, the notochordal canal communicates with the yolk sac. Through the primitive pit, the notochordal canal also communicates with the amniotic cavity. Thus, a temporary communication between yolk sac and amniotic cavity is established. This communication ensures the nutrition to the ectodermal surface of germ disc till the formation of blood vessels. The remaining part of notochordal process becomes flattened and forms a flat plate of cells known as the notochordal plate. This notochordal plate gradually folds along its long axis and separates from the roof of the yolk sac which is now lined by continuous layer of endoderm. The cells of the notocaudal plate begins to proliferate in the cranial caudal direction. These proliferating cells enfolds and forms a solid flexible cord of cells known as the definitive notochord. The notochord functions as primary inductor. It stimulates the development of primitive vertebral column, and it induces the overlying ectoderm to thicken and differentiate into neural tube. The notochord degenerates with the beginning of the formation of vertebral body. The remnants of notochord remains a nucleus pulposus of intervertebral disc.
Okay.
And apical ligament of dens.
The summary is what I gave, okay? Don't be confused by this. So I'll load 4 videos. This is just 2. 2 will talk about gastrulation, and then 2 will talk about neurulation. But remember, these processes happens together during the 3rd week. Whilst the epiblast is converting to form ectoderm and mesoderm, and then helping the hypo to form the endoderm, there are other things that are happening, connecting the amniotic to the yolk sac, allowing nutrients to flow through the baby, developing embryo, and also helping the formation of the notochord. The notochord will give a signal for the formation of the vertebral column, the brain, and then the vertebral aspect. In other words, the nervous system. Okay, so that's all what happens in week 3. So you see, if you consider week 1, week 2, week 3, all what is forming during those times are very important, especially when it comes to the ectoderm, mesoderm, and then the endoderm. The process to form the 3-germ layer is called gastrulation, and the process to form the notochord that virtually form the spinal cord and the brain is also known as neurulation. So that's all what the video is saying. Now let's share today's lecture. Hey, why is this now on the video? Hey, can you switch the video off for her?
Victoria, off your video.
We want to what you got to okunu sukura na wasa. In person bia.
Ye di anke ebe show.
Adai. Munya bi nhwe. Awe susu befe. Okay, let's share today's lecture. Today's lecture is week 3. So today's lecture, can you see the screen?
Yeah.
So today's lecture is about gastrulation and neurulation. Okay. So this is the reference material. Now my medical embryology 11. So week 3 starts from 14 days to 21 days. We've done day 1 to day 14, and then we're going to continue from day 14 to day 21. Okay. But before we talk about day 3, week 3, or day 14 to 21, can somebody summarize 1 and 2 for me? Just give me a quick summary of 1 and 2. Anybody? Any hands up? A quick summary of 1 and 2. Come on. You can't tell me that no one can do that for me. 650 people. Come on. Yes. Okay, let's do it one by one. Week 1. Summarize week 1 for me. Week 1. Anybody? Any hands up? Week 1. And then another person will do week 2, or you can do week 1 and 2. Then so that we put it on week 3 and then move on. Anybody? Come on, ladies and gentlemen. I have 650 students online. Come on, start talking. Yes, nobody? Hey. For free marks. Oh. Course reps. If no one is talking, then I'll mention the course reps. Dorcas. And then Belinda. Well, let me see the course reps. Let me mention the course reps name one by one. Gosh. Let's start from Kumasi. Kumasi course reps. Yes. Okay, I have one hand up. Thank you. Thank you very much. Rhoda, you have the floor.
Sir, please, I think I remember we started with a recap of the anatomy of the pelvic.
No. Start pre-zygotic after fertilization. So start after fertilization. That's what I want. We are not starting from that end. No. After fertilization, week 1, week 2. Rhoda, go on. Okay. So that too.
Sir, please, we spoke about fertilization, and you said the fertilization takes place in 3 events. And the event is
my dear, start after fertilization. Yes, after.
So after fertilization.
So fertilization has taken place. Start from cleavage.
I should start from cleavage.
Yes, the division, cell division after fertilization. Start from there.
So after fertilization, the fertilized ovum will begin to replicate, like to multiply from 2 to 4 to 6, and during the process it is guided by the zona pellucida, that is ZP. So as it is dividing, it will not increase in size, and it will start from 2, then 4 to 6, 16. From 16 to 32, it is called the morula. And then at that point,
okay.
Wait.
So that you've jumped something. Now division from 1 to 2, 2 to 4, 4 to 8. 8, we said something about the 8 division. We said the cells are called what?
Totipotent. I forgot the name, but I remember you said each one can.
Okay.
And you said each one can form a full.
So yes, somebody should come in. So we say it's totipotent. Each blastome here is totipotent.
Yes.
Okay, good. Continue from there.
And you said with the totipotent, each one can develop into a full-grown human being, and that's when you are doing what's the name, IVF. When it reaches that point, they can take it and then make each one develop into a full human being. But from there to go to 16, that is the morula stage. I don't know if they are hearing. The phone is misbehaving. It will go to the morula stage. That is from 16 to 32, and at that point there will be a fluid field formation called the blastocell, and the part that is fluid field will form. So you say along as it is going, if by coincidence the zona pellucida is opened and release the cleavage, that is those that are dividing, it can get stuck at the fallopian tube and ectopic pregnancy will occur. If not, it will move to the uterus, and then when it gets to the uterus, then that is where the zona pellucida will release it.
Okay,
so that
so that
the
is week
implantation
one.
was.
So what will actually cause them? What we implant? The one that implant, how do we call it? That stage, how do we call it?
The question.
The blastocyst. Okay.
Yes, sir.
Okay, so that's good. So that is week one. So that who has mentioned week one. She has mentioned the cell division. This stage from totipotent, pluripotent. Pluripotent is also known as morula. Morula will absorb liquor and then push all the cells to the periphery, forming the trophoblast and the inner cell mass. And then we still have the ZP there. If the ZP hatch quickly, there's a trouble. If it hatches late, there's also trouble. But if by God's grace it goes smoothly by protein and enzymes, it will digest it and then to hatch and then implant. The blastocyst will undergo implantation. So that is where week one is. And where is week two? Week two. Somebody else should take week two. Why are there passed not to waiting room? Week two, yes. Anybody to take week two? From blastocyst. Week two. Come on, ladies. I swear that too. When you finish, test me your index number, okay? You have 5 marks. You've done well.
Thank you.
Week two, somebody else. Oh, swear that, take it there and then get another 5. Make it 10. If they want to, take it. Implantation. We said implantation involves 3 steps. 3 steps for implantation. Just mention the steps, and then you tell me what happens to the blastocyst at that time. That's all. Implantation, 3 steps, and what happened to the blastocyst at that time, and then we are done.
Hey.
Then we start with.
Can I continue? It's all that.
I'll continue and take the other ones. Yes, continue and take it. Okay, wait. Somebody's hand is up. Wait. Janet, Mama.
Hey.
Mm-hmm.
Or in the week two, we have the implantation. So in the implantation, it involves 3 stages. The apposition, adhesion, and the invasion. So we have the attachment, which occurs around the 6 to 7 days after the ovulation. Then in the apposition, it's between the blastocyst and the uterine epithelial cells. Then with the attachment, the zona and the glyco.
Does that zona pellucidum?
The zona pellucida and the glycolic.
It hatch and then implantation will start. So,
yes, please.
So
the trophoblast.
The trophoblast will do what?
It will opposes to the epithelial cells
of the endometrium. Continue.
Then there will be changes in the endometrium. There will be changes in the uterine endometrium and the stroma.
Okay, continue.
The stroma too will lose collagen fibers, and the cells too will swell. Then the stroma will become the primary decidua. The stroma will become the primary decidua, and the maternal blood vessels too will grow in.
Hey, what you are saying, you are like, I see like you are reading. You are confused yourself. Okay. Now the attachment, when the invasion starts, the trophoblast will differentiate into syncytial and then cytotrophoblast. The syncytial will push itself through the endometrium till it gets to the basal area where the aspect of the syncytial is to get maternal blood. While the syncytial is ongoing, it will form spaces within it we call the lacunae. And then When it gets access to the maternal blood will drain into the spaces within the syncytium. Remember, it is the cell division of the cytotrophoblast that pushes the syncytium to invade the endometrium. Hence, the cytotrophoblast will be giving feedback reaction to the corpus luteum by secreting ACG. Hence, corpus luteum also produce progesterone. That is, and then the inner cell mass will also differentiate at that time to form epiblast and then hypoblast. That is the end of week 2. So Janet, I'll give you 2/5, okay? Oh, 3/5 rather. And I'll give Saida 5/5, okay? So when we are done, you test me your index number, I'll start recording your marks before your Mason, okay? Good. So henceforth, I'll be sharing marks as I'm talking. So when you answer question, I'll give you marks. Answer, give you marks. Okay. So Saida 2, let me even write it down before I forget. Give me pen. Janet Foma and then Janet.
Hey, sir, I'm in class.
Are they? Oh, mass them better than say another one may have content. So it's weather 2/5. Janet Foma. So weather 2 is it wow tamale?
Tamale.
No.
Janet Foma.
Sorry. Kumase.
Janet Foma, you have a third name. Add it so that I don't confuse myself.
Mesa.
Okay. So Janet, you have 3. Good. And then so that 2 by the end. So that is the end of week 2. Okay. So what we're going to do today is week 3. So I've shared the PowerPoint for week 3. So we have a blastocyst that is embedded in the endometrium. And then we have the trophoblast differentiating into 2. The inner cell mass also differentiating into 2. That's all.
Sir, you are super.
Yes?
Sir, who go first or your patch? Why?
Oh, where revision? I think about week 3. Week 3 was screening. So
Nothing is showing, you know.
are you sure there's nothing on the screen?
Sir,
It's now showing.
now it's
So the writing is
You can see week 3. The slide.
Please, we can now see it.
Okay, good. So now your 2 sisters have already summarized week 1 and week 2 for us. Now, from one cell, it has differentiated into something that has embedded into the endometrium. Now, week 3 has to do 2 things. Now, if you read the first PowerPoint, we say 2-layer gem disc. So that was it's talking about the blastocyst that is embedded. And then it's going to form, so if you watch the video, we are saying that the 2-layer, the endo, the epiblast, and the hypoblast. Okay, epi is above, hypo is below. So the inner cell mass, there will be a streak. A streak is something like a gutter that will form on the epiderm, epiblast. Okay, so if you watch the first video was talking about we call it the primitive streak, a gutter that will form on the epiblast. So that's the second layer. We say primitive streak formation. So the streak that forms, it gives us 2 things. Number 1, the streak forms from the CODeL of the developing. My network is not stable, so let me explain this quick.
This meeting is being recorded.
So from week 2, please, can you keep quiet for me? My network, so that I can speak faster. Co-host, can you take them out? Please? Okay, so let's go quickly. From week 3, I said number 1, formation of 2 laminar discs to 3 laminar discs. That is gastrulation. And then formation of the neural cord. Now, this is how it is formed. Now let's get this one. Now let's concentrate on the picture below. So this is the superior view of the epiblast. And now we're going to get a primitive streak that is formed in the epiblast. You follow the arrow. This streak is like a gutter. A gutter will be created within or at the epiblast. And this gutter will let
Sir, please, your line is breaking.
This is the tail region. So the primitive streak starts for usually the caudal part of the embryo part. So number 1, primitive streak shows us the caudal part of the developed embryo, and then show us also the cranial part. So we start from the caudal part. Again, it gives us symmetry, left and right. Okay, so when it divides into 2, it will show us the right part and then the left part. So there are 2 things the primitive streak will teach us: the lower parts of the embryo and the cranial part of the embryo. Okay, and also the left and right part of the embryo. Now this primitive streak actually will help us also to create a gutter that will allow the cells of the epiblast to invaginate. So actually the word is invagination, meaning that the cells, let's get a picture to show that. So this is the streak in everyday life, normal electronic aspect. This is the streak, okay? And this is a picture of the streak creating. And then we have the node on top. The streak, when it's created, allows cells of the epiblast to invaginate or enter the gutter, enter the streak, to make sure that, number 1, they will separate the epiblast from the hypoblast, and there's a space created, and then they will move and fill that space. Okay, so cells that are the epiblast needs to move into the streak to occupy the space between now the epi and the hypo. Now the movement of these cells are controlled by genes. So as far as the gene is activated, the cells will move. So we have a gene to start allowing the cells to move into the streak, and then another gene to stop it. You see, the most beautiful things in developing baby is that these things are not known. It's 3 weeks and it's controlled, and these things are controlled by gene. So gene for invagination, I'm not after the gene here, okay? Just for you to know that they are genes that control. It's not that the cells are just moving. There are genes that control them. So the gene will be activated, the gutter will be created, and then the gene will start invagination. So in A, we can see the endoderm aspect. So the first invagination will go and display cells in the hypo, okay? And the second invagination will also form the meso. So actually, it is cells from the epiblast that will go and add up to the hypo to form the endoderm. And then other cells will also come and occupy the space created between the hypo and the epi. So at the end, we are going to get a definite endoderm, and then a mesoderm, and the cells that will remain at the epiblast form the ectoderm. Okay, so this is how from bilaminar, trilaminar are created. Bilaminar means epi. To form 3, first. Number 1, primitive streak. The gutter will be formed. The gutter will be formed from the cauda and then to direct to the cranium. Okay, when that gutter is formed, cells from the epiblast will now start entering the streak, going to replace cells in the hypo. That's the first thing. And when that is saturated, the invagination will again move cells into the space to form the mesoderm. And the remaining cells there will form the ectoderm. Okay, so this within 3 weeks, that's the most important aspect, gastrulation. But it's not just gastrulation. If you look at the picture here, epiblast, this is the epiblast. Now cells are moving on to form, number one, ectoderm, and then when they are saturated, cells will move to form the space, between the space to form the mesoderm, and the remaining will form the ectoderm. So formation from 2 to 3, that is it. That is what we call gastrulation. Okay. And then if you look at the picture below, day 16, still on week 3, this is showing how the cells are moving. Some cells are moving into the streak, and will be moving laterally. So while some cells are going in, others will be going lateral to fill the space that is created. Now, these movements of the cells are very important, because if a cell is supposed to move to go and form mesoderm, if a cell is supposed to move to form endoderm and doesn't move, there will be a problem. If the cell is not supposed to move, it's supposed to stay, and that cell also move into the streak, there's a problem. Okay, so this movement of cells are controlled by gene. Okay, so here, this is important. Now, this is the cranial head. It means that the streak will be formed from here. So this is the CODeL. So this is where the streak will be formed. This is the noto primitive node. So the streak is here. And cells will invaginate to go below or in the middle. Now, notochord formation, if you remember the picture for notochord or the video for notochord, we say that when cells are moving in, let's get another, I'll come back to this. Now look on the screen. When cells are moving in, when they cease, we have a plate. Now this is a notochord plate that will curve and form a notochord tube. So cells will go in the middle, they will join the endoderm and then detach themselves. We call them notochord plate when they detach. Now the plate will curl and form the notochord tube. That tube is what is going to develop in the process to help the formation of the spinal cord and the brain. Now look at the picture B very well. Look at B very well. The system. Look at B. If you look at B carefully, you see that mesoderm, the one we call mesoderm, the red one, it is not complete. It's not fused like the yellow one or the blue one. Can you see that? Can you see that the middle one is not a line?
Yes, sir.
It leaves a space.
Yes, sir.
Yes, sir.
And there is a pinkish aspect there we call notochord. Okay, so if I take only here this portion alone, let's see the slide, the other slide negotiates that. No. Oh no. Let's go back. Now here. If I take only this, follow my cursor. Focus on B. Focus on B. And then follow the cursor. Now, if I ectoderm, the mesoderm, and the endoderm. Now you can see that mesoderm is not complete. There's a tube here we call notochord, and then there's one part of mesoderm here, and then we have other parts on top. Now listen carefully. I'm going to name the part of the mesoderm. Mesoderm, the one in the middle that form the plate is called the asia part. Asia, like middle, asia. Okay. Then this small part closer to the asia is called paraasia. Paraasia. So asia is in the middle, the one that form the notochord. This part is called the paraasia part. And then when you move to these two portions, we call these parts the lateral plates. So we have the asia, paraasia, and lateral. I hope you can see that. Hello?
Yes, sir.
Okay.
Yes, sir.
So now let's go back. Now in this PowerPoint, it's telling us what forms what. Now the Asia mesoderm. We say Asia mesoderm form the what? The notochord. Asia mesoderm form the notochord. So that is it here. The one in the middle. This one. The Asia mesoderm form the notochord. This is it. Okay. I said this part is called para-Asia, and this part is called the lateral plate. The lateral plate, you have the superior and the inferior. Okay. Superior goes up, inferior goes down. Now, can you read what para-Asia forms? Yes, para-Asia, we say it forms what? Yes. Can you read what para-Asia forms?
So it forms skeleton, cartilage, and
It forms
dermis.
what?
Cartilage,
Skeletal muscles and dermis.
So in other words, it forms the connective tissues. Okay, our cartilages, our bones, our muscles, everything is formed by the para-Asia. Now, can you look at the lateral plates? What it forms? We say lateral plate forms what?
circulatory system and body cavity linings.
Okay, so in general, if I ask you, what structures are formed by the mesoderm? What will you say? What structures are formed by the mesoderm?
Connective tissue and circulation.
So, muscles, bones, cartilages, and then what? Cardiovascular system, the heart, and the body cavities and the lining. Okay? Can you see that? So mesoderm is not just a whole plate like ectoderm and then endoderm. It has part. It has the notochord part that will form the vertebrae. And then we have the para-Asia part and the lateral part. The lateral plate has two parts, superior and inferior. And we are saying that along the line, they will develop, the lateral will form the circulatory system and the body cavities, whilst the para-Asia will form the connective tissues, and then the Asia will form the notochord. But ectoderm, let's go back here. Ectoderm forms what? It's on your screen. Ectoderm forms what?
Outside surrounds
The skin
And nervous tissue.
And then endoderm,
Epithelial lining, gut, lung, and urogenital
when you say
tract.
gut, what do we mean by gut? Gut.
The digestion. The digestive system.
Okay. So all the digestive system aspects, respiratory system. So isn't it obvious? Respiratory is coming from endoderm, whilst cardiovascular is coming from mesoderm. So at times people think that the lungs, that is why when you go to their place, their cavity, their heart too is in their, okay. And then urogenital. Urogenital means urinary system and genital system. So the kidneys, the ureter, the bladder, and then the reproductive organs are all formed by endoderm. Now, if you ask you, so if somebody takes a concoction to abort a baby, which of these three layers is likely to be affected and why? If someone takes something to abort a baby, concussion, which of these three layers will likely to be affected and why?
Sir,
Yes, anybody?
Miss, it might depends on the type of concoction. Like when you come to the drug that we use to cause abortion, that is the Medabon. It has the mifepristone, which prevents blood supply to the fetus. In that sense, it will affect the circulatory system.
I hope you know when we take that drug to abort the baby. You know, we
Yes.
can take it only at a particular time. When do we take it, my dear? When? Before?
Before 12 weeks of gestation.
So 12 weeks means that we are 12 weeks means we are still in gastrulation, isn't it?
Yes.
Yes, please.
So it means at that time we are still looking at the 3 germ layers. Okay. Let's say somebody is 4 weeks or 5 weeks pregnant. She's still looking at the 3 germ layers. So the first drug, when you take that drug, the first drug kills the fetus. It kills the developing embryo, and then the others will contract the uterus. That's why we don't use cytotech only for abortion. It won't work, or if it works, you bleed to death or can bleed to death. But the first one will kill it. So whenever somebody takes that drug and does not even come, the fetus is dead. There's nothing like fetus. It will kill it. Okay. So if somebody takes drug here, the system or anything that is will be affected first is ectoderm. Ectoderm is skin. It's the external part. So if we're looking at it, it is formed from the epiderm. So epiderm is always on top, and the others are below. So anytime anybody takes any medication, it affects it. So if a mother, you are a midwife, I hope you've seen a lot of it. If a mother was taking some drugs or anything at all, when you give birth, you can see the skin of the baby or the nervous tissue, the brain, the spinal cord, the nerves, spinal bifida, and all these things. Okay, the extremities. So when it goes deep, it affects mesoderm. Mesoderm will affect the muscle. So you see the extremity and the bone. You see the baby's extremities to be different. The formation is bad, either less or that. Okay. So this is it affects skin, nervous system first, and then it move on to affect the connective tissue. So that's the approach. That's why when people take a lot of drugs, alcohol, and everything, it affects the brain and the skin of the baby. Ectoderm. Okay. So that's the basic aspect. But remember, mesoderm has parts. Mesoderm has asia, paraasia, and the lateral plate. Each of them forms something different. I'm repeating. Mesoderm has parts. Asia, paraasia, lateral plate. Lateral plate has a superior and inferior part. Each of them forms something different. Okay. Hannah, your hand is up.
Sir, please, I have a question. And
Yes,
my
my
question
dear,
is, usually when the mothers take, there is no connection between the mother and the baby, because the microvilli, the villi that is formed, there is a separation between the maternal blood vessel and the fetus, such that even if the mother is infected.
Hannah, don't deceive yourself. Last time we said that the cytoblast, okay, the trophoblast differentiate into syncytial and cytotrophoblast. And we said that they form barrier. Now listen carefully. These barriers they form are permeable to certain things. And I said they behave like the DIBY. I hope you understand DIBY.
Yeah, blood-brain barrier.
Yes, sir.
Good. So they behave like that. So that is why, though they are forming barriers, but if the mother is even diabetic, it affects the baby. Okay? Because glucose passes through the barrier. Alcohol passes through the barrier. So the barrier is not impermeable. It's permeable to certain things. Okay? So never say anywhere that there's no connection. No, please. Because the syncytial trophoblast, what is it going to do? Get maternal blood into the lacuna and to diffuse through the sieve. That sieve is permeable to certain things. Even at gestation, at gastrulation level, it's permeable to certain things. That's why if the mother is diabetic, the baby will be affected one way or the other. But let me ask you, if the mother is asthmatic, would it affect the baby?
No.
No, sir.
Why?
Yes, sir.
So these are a few questions we want our midwife to bother on. If the mother is diabetic, it will affect the baby because sugar can pass through the barrier. Okay. But if the mother is, I said what? Asthmatic, will it affect the baby?
No.
No, sir. Yes, sir.
It will affect or it won't affect?
It might affect and it
will
might not.
affect.
It won't affect.
Explain yourself.
It
That might affect people. Explain your mind. Mind for no explain. Let's go on.
Say,
Yes, those who said mind. Yes.
because like what the asthma is not an infectious condition, so there's no way it's going to travel through the placenta barrier. And another thing is that asthma is an allergic reaction, so the baby is carried by gene. The baby is likely to get it because the mother, if they are looking for the family history, the mother is passed. So, and then if the baby too can become allergic just like the mother. Somehow that is how I understand, but it's not because maybe it will travel to the baby.
Hannah, you think wow too much. Be careful. Hannah, the mother is asthmatic. It's a gene. There is a probability that that baby won't even get the gene. The baby's gene are coming from father and mother. So there's a probability that baby will not even get it. Okay? If your mother is something, doesn't mean automatically you get it. Because you are getting 50% from your mother and 50% for somebody else. It will become detrimental when your father and mother have that gene. Even that gene can be recessive in you. So never tell a patient that so far your mother is like this, you too going to be like that. No, it's not like that. Gene don't just transfer and then activate. You can even have the gene, can be recessive, can even work, can never work in you. But when you give birth, it will work. There's a probability it might work in your kid. So yes, grandmothers can be asthmatic and grandchildren can be asthmatic, but the mother will never show sign of asthma. So related to my question, asthma and then the pregnancy, that's the question. Will it affect the baby vis-a-vis pregnancy? No. But diabetic vis-a-vis pregnancy, yes, because it passed through the barriers. So that's how we have to look at the whole concept. What again passed through the barrier? Alcohol. So if the mother is pregnant and takes alcohol, can it affect the baby? Yes. Which part of the baby? The ectoderm. So automatically the skin and the nervous tissue. I hope you understand the whole concept. You see, we are talking about differences happens in the first trimester. There, not the BCS, but first trimester, and there is nothing to worry about. That's what third trimester women, we treat them as, we can give them drugs, we can give them anything. But first and second, you have to be careful when you are dealing with them. Okay. I hope that it makes sense. So
yes, sir.
Your understanding of all these things is very important. It's very important. Don't conclude just like that, please. Understand the whole concept before you talk. Remember, gastrulation and urulation happens at the same time. Now let's follow to the end. Oh, no. Yes, Mary, your hand is up. I hope it's a follow-up question or related to, don't throw me out. My network is bad today.
Please,
Yes.
the asthma issue, I think maybe I was thinking the baby will not get enough oxygen in the utero. That was what I was thinking.
Mary, have you had an encounter with an asthmatic patient before? A pregnant one?
Yes, sir.
And then tell me your experience.
I said the mother was finding it difficult to breathe.
When? During labor?
No, during pregnancy. Yeah, anytime.
So what were you telling her? It means that the mother does not know her allergens. It needs to be, it will be triggered by something, and it will allow the respiratory system, the muscle within the bronchial to react. So asthma is not a disease, it's a condition. So what were you telling her? If she comes to your end always with attacks, it means that there is something that is triggering it. She has to look for it. If not, it won't stop. So what were you telling her?
So the same thing
and
that you just said.
And you can then Mary, many everyone. What can they
Well, I told her to stay away from things that would trigger her asthma.
So are you sure she knew the things that would trigger the asthma?
I said, please, some of them don't know. So you have to educate them so that they'll figure out those things.
And when she gave birth, the baby was
No, as at that time she was pregnant, so I didn't know what happened when she gave birth.
So it didn't follow to the end?
Yes, sir.
So why do you assume that Nebano I hope you know that the maternal blood contains oxygen, and that's what the babies use. The baby does not use the lungs in vivo. The lungs of the baby becomes active only at birth. That's why they cry. And that's why it's important for a baby to cry. When it comes out, that's the first time in his life he's using the lungs. So if you want an organ that is exactly the same age with us, it's our lungs. Our lungs were formed, but they were never used. They were used the first day we started day one or the second one. Just first, second. That's where our lungs work. So if you want an organ in you, that function is equally your age. It is your lungs, not your brain, not your heart. It is your lungs. So Mary, no question. Your lungs become active only that time.
My question is, okay, but why is it that when the mother is finding it difficult to breathe, sometimes we say that the baby is asphyxiated in the if mother I find it very difficult to breathe. You see, if we check the baby's fetal heart rate also drop.
Yes. But I don't know, interested. You see, what we are trying to tell you is it'll be a diabetic. It affects the baby directly. If someone is asthmatic and it finds it difficult to breathe, if we come to our end here, we give you oxygen till you are settled, we nebulize you. Doesn't mean that the baby is going to suffer. But somebody who is diabetic, what can you do? Sugar only bathroom cry ankle. Okay. So we want, and then, so what was the problem here? Because we can regulate it quickly. That's not anything that will affect the baby much. But if somebody is diabetic, hypertensive, and those things, it's difficult. Okay. So understand it carefully. Now, the last aspect is when there is, this is gastrulation. Now, this page is showing you the cells, okay? We have genes like sonic H-Hot gene, FCC gene, okay? FG, FH gene, okay? These are genes that function is to activate these movements of the baby in gastrulation. So this slide shows a bit of the gene. For instance, if you read point 3 here, SHH and FG, F8 can randomly end up on right side. You see, when these two genes don't function well, you have a condition we call situs inversus. Okay, like this. Okay, maybe I'll come to situs inversus. Let's go back. Let's go quickly. Here, situs inversus means that everything has 10. Your heart is on the right side. Your liver is on your left side. Your stomach is on your right. Your appendix is on your left. Everything in you has changed. Just because two genes fails to do their work, okay? So movement of these cells going here, passing here, differentiation to form this, all is controlled by gene. So when the gene fail, something might happen. So ladies, if you want to pray about something, pray about your gastrulation and your relation if you are pregnant. Be specific to God. Pray about your gastrulation and relation, because this gene, no one control them. They can switch off, switch on anytime they want. So for me, the biggest miracle I keep on telling you is when somebody gets pregnant, give birth, and then the baby is 100% all right. For me, that's the greatest miracle. Because as an embryologist, all these gene, all this movement triggers me. You take an X-ray, you see a scan, you see the baby's head now, you do an anomaly test, there's nothing. That's the biggest miracle. And that baby will be born and it's perfect. After 1 year, 2 years, that baby will be fighting you. You see the beautiful thing? That's the whole thing. For me, that's the biggest miracle, because gastrulation and relation, no one controls it. It's controlled by gene. If they fail, you fail. And then no one can stop. You see, this gene activation and deactivation is very crucial. That's why when you are pregnant first trimester, we try as much not to give you some certain medications. If you go to China, there's no medication when you are in first trimester. And it's the only thing they will let you do is food supplement. Food that you get your folic acid, your iron, and everything. Food, not drugs. Okay? Because they believe that this gene can be affected anyhow by any circumstance. Radiation, for instance, will pass through this. And when I say radiation, you know what I'm talking about? Tell me the common form of radiation. What's the common form of radiation?
X-ray.
The common form for radiation is what?
Sun.
Thank you. The sun. It's not sound, please.
The sun.
Area, the sun. S-U-N. That's the common form of X-ray, of radiation. That is why we tell pregnant women to take umbrella while they are walking in the sun. That's the reason we tell pregnant women to use umbrella when they are on the sun. Or you never told them to use it. First trimester woman.
No, sir.
Hey,
Oh, sir, we never told them.
I never knew.
I don't know.
Really don't know.
Thank you. Today the word has come to you.
Thank you.
We say when the word comes to you,
It
it gives you the truth.
Thank you. God bless you.
Today you've seen the truth. So please, please and please. Now, those in the northern part, Wa and Tamale, I can feel even from Kumasi the scorching sun. And you have somebody pregnant, first trimester, moving in this sun. Oh God. Without an umbrella. We are talking about radiation here, switching this gene off and on anytime. And you're talking about X-ray. The most common radiation is sun. And now I hope you know that the sun that is coming out this time around, the ozone layer is depleted though. It is gone. Midwives, do your work. If you didn't know, now I'm telling you, tell them to use umbrella, something to shield themselves from the sun. It's not advisable. It's radiation. Right. God have mercy. So today you've seen why they have to use it. Mavis.
Said those farmers cannot use umbrellas. So.
Which ones?
In the
Which
farm
ones
cannot use.
Mind the farm. Mind dear, I'm not saying umbrella. Anything to share themselves. Okay. If it's hats, me when I come to Tamale, my hat is like a mansion. I wear big hat. Me who is a man. Tell them to wear something big to show themselves. Okay. Hey, okay. Now let's look at these things quickly and then end the lecture. Now, organogenesis. Now we've seen how the 3 germ layers are formed. We've seen how ectoderm, mesoderm, and endoderm are formed. Now, organogenesis. How would these cells or these layers determine the organs that we've mentioned? We said ectoderm will form the skin, nervous tissue. Mesoderm will form connective tissues, including other aspects. The endoderm, including circulatory system. Endoderm, we said, will form digestive system, urinary system, reproductive system, and then some few other things. Now, how would these cells do that? Now, we say that for cells to be able to do that, the first thing is that their cell's determination. When the cell is determined, it has been programmed. Another way to say determination is programmed. The cell has been programmed to do certain things, to move and form this and do that, okay? How would there one inheritance, okay? Remember, in fertilization, I said that we get a lot of things from our mothers. Apart from the genes that we get from our fathers, all the cytoplasmic proteins and everything is gotten from our mothers, inheritance. So we inherit most of the things from our mothers and our fathers, okay? So the cell determination for the cell to go and form, that is why we can look alike. We can look exactly. Some people, when they are there with their father or their mother, you can't see differences. The way they talk, the way they walk, it's like a chip of the old blood itself, okay? Because the gene has been transferred. So her inheritance gene will take over and they will form exactly what they were asked to do, a photocopy of the other partner, okay? Inheritance. So cells are able to form organs, number one, by inheritance. Number two, by interaction within themselves. You see, some cells behave at times like they are attracted by other things. Okay, we have people that goes to work and they'll be attracted with somebody that they won't even do the work. Okay, so cells also behave that way. So at times when I see people like on concern, gossiping and everything, all what they do in their life is gossiping, I look and I understand why they behave that way, because in fact their cells behave that way. So interaction with neighboring cells means at times these cells are programmed to be ectoderm, but they'll be interacting with certain cells before you know it has followed that cell to another place and form mesoderm, and hence and cause trouble. So apart from inheritance, another way cells will determine their fate is by interaction with neighbor cells. Now, with interaction, we call it cell induction, chemical reaction between another cell affecting the neighboring cell. Okay, so if all these interactions and then gene field, we have something we call situs inversus, like this picture. Situs inversus means that everything have changed. I've already mentioned it. Okay, so anytime, never assume everybody's liver is supposed to be on your right. We have people that their liver is on the left, their stomach is on their right. Okay, so never assume anything as a scientist. It's not that everybody's heart is on the left. We have people that their heart apex faces the right. Okay, so that is what we call situs inversus. When we add situs inversus to thales, it means both thorax and abdomen have changed. Now, those that only abdomen have changed, we call them dextrocardiac. Dextro means right, dextrocardiac. We have people, their abdomen is correct, everything is normal, and then the thorax are changed. We call them dextrocardiac, okay? In my practice, I've seen only one situs inversus that's alive. Most of them, we see them at death. When you open them, you see that they are situs inversus. So a lot of people don't know they are situs inversus, okay? The only one we saw was coming for a screening, and then took an X-ray, and then we saw that the heart is mispositioned. So we did abdominal scan and also saw that all his organs were also predisposed or disposed. And then we also follow him for almost 4 years now, checking his case, checking everything. They are all normal. And there's nothing wrong with him. So it doesn't mean that when you are situs inversus, it will affect you. It won't. But it's not also transferable, because it means that some of his genes were gossiping and then they missed rotational defect. Okay. Now, this is the other problem. Now, the other problem is not enough gastrulation. Not enough gastrulation. Not enough gastrulation. Gastrulation is not enough. Gastrulation means that primitive streak formation, cells moving and then closing at the normal time. Okay. Now we say premature regression of the primitive streak leading to widespread loss of trunk and limbs. So if you look at this baby, the limbs, the cells that were supposed to move to go and form the limb did not go. Gastrulation ended too quickly. So let's look at her problem here. The first problem with her is called vater association, vertebral defects, anal atresia, tracheoesophageal fistula, and renal defect. It means that the cells that were supposed to form, to move from the epi to go and form, help the hypoblast to form the endoderm did not go. So there's renal defect. Tracheo lungs, also the same aspect, anal, caudal aspect, and then we have vastus. She also will have cardio defect and then limb defect. Okay. So we usually don't see them. That's why this consultant is very happy taking picture with the baby. Okay. This happens when there is no enough gastrulation. The primitive streak closed too early. So the cells that were supposed to move did not move. Caudal agenesis, also known as cynomenia. Okay. And then also, my popular one is this. So this is the picture I have as a cover on the book. This is too much gastrulation. Okay, if the primitive streak fails to regress, you see, when the primitive streak is formed, it's supposed to close. For some people, the primitive streak does not close. Hence, cells the cells that are supposed to move and form other things will move with the others. In other words, the cells were supposed to stay and they move. So after the formation, they become excess. And the body will align them at the caudal. So you are excess, you don't have anything to do. So they will get them here. So this is excess cells pushed to the caudal part of the baby, hence affecting the anal aspect a bit. Sacrococcygeal teratoma. Okay, good. So this is too much gastrulation. So gastrulation, when there's not enough, there's a problem. If there's enough too, there's a problem. So it should be optimum. So if you remember from fertilization, everything is a program. It should be optimum. If anything fails, it will miss it. Take it that way. So those of you, when you go to the seamstress, they sew your attire and then beat that way. Anything, any small mistake result in something else. Any small mistake.
Sir, please, you've muted yourself.
Actually, that is the end of the lecture. Okay. Any small mistake will result in something else. So these are the problems related to week 3. Week 3, each of these has its own problem. So week 1, what was the problem? Week 2, what was the problem? And week 3, what is the problem? So each of these result in its own problem. Okay. So each system has its own problem. Ladies and gentlemen, we are done with week 3. Now week 4 and the others will be a combined. We're going to do extra embryonic membrane, and then that will take us to cardiovascular formation, nervous formation. We can do 2 or 3 systems before the semester ends. Okay. The way we've spent more time on the reproductive system, but it's worth it. It's not bad. Okay. But since we've done week 3, we've understood where everything comes from. The other things is just correlation. We're going to correlate this gene to this part to that part. Okay. So that is week 3. Any question? Okay. So week 3 is very simple. From bilaminar to trilaminar, we call gastrulation. And when gastrulation is ongoing, another process is going that we call neurulation. So gastrulation and neurulation go hand in hand. When gastrulation goes on and everything is good, we are done. But if gastrulation should fail, it will result in any of these. Okay. So remember that the mesoderm has other parts and each part will be involved. So in our next meeting, we'll be taking each part, we develop it to the full aspect. So please take note of that. After our test, today the tests have increased the hours. Hey, yeah, right. Go forward here. Okay. It will open for 18 hours, not 12 hours. So it will start 7 and go the next day somewhere around 1. So feel free and go in and do your test. Your test will be something like a 20 minutes and then you are done. Okay. And then the next test will be we're going to do fertilization in week 1, and then we do week 2 and week 3. But if you don't have time, I'll gather everything for you. Okay. So we have
Sir.
2 other tests, but if time is not on our side, we do 1 test in addition to this. Any question?
Please, sir, please. Sir.
Yes, go on, my dear.
The video on the menstrual cycle, still we haven't gotten it to.
Go on, my internet is not good today, so talk faster.
Sir, please, the video on the menstrual cycle, we haven't gotten it.
She's gone. Okay.
No, sir, I'm here. Hello, sir. Hello, sir.
He said his network, maybe then, or is it the network? Oh, his network is not working.
He's on there, but
it seems he's not even here.
It's concerning the video on the
menstrual
audio
cycle.
on the menstrual cycle. So it's not in.
Maybe you can contact the class reps and see, or
Lecture 4 and 5 are not in, so please, if the reps can help us, we will be very glad.
And moreover, most of the slides too are not in his book. Outstanding.
please, can we exist now?
Yeah, I believe so, because now he's not in. He has left.
The other time,
we have to exit.
He may come back.
We can't hear him.
the other time when we left, he he was complaining. So I don't know whether.
He may come back. Let's wait for a while.
Oh, okay.
So let's wait.
Okay.
Please, the reps, can you help us get the recording from the school? Because the other one on the page is not complete.
Sister, all of the courses, even child health camp, you can't even find it on YouTube. All of the courses, we are not getting the recordings. We are begging you people, do your best to help us.
Okay, any question? If no question, my network today is not stable. So,
I have a question.
Deborah, your hand is still up. Any question?
Please, can we get the slides? 4 and 5 are not in the book.
What 4 and 5 are not in the book? Which one? What is 4 and 5?
Sir, please, let me ask my question, please.
Ask your question. I don't understand what she was saying. 4 and 5,
Sir, please.
Those with retroverted uterus, can you say they have a situs invertus?
Oh, no. We see, so far as a lot of people have something, we say it is normal. It doesn't mean the others. So that's not situs inversus. Situs inversus actually happens to the abdomen and thorax.
Okay, thank you.
So they have another position for their uterus. Okay. Good.
Sir, please,
any
we're
other
talking
question?
about
If no question, my network today is not good. It's affecting me throughout the whole day. So we end and then we concentrate on the others.
Slides, please.
Please, there's a question.
Say. Hello.
Say.
Sisters, please, those that can hear, can you help ask the question for me?
He's
about
gone
the
again.
recording?
No. He's gone again.
Please,
Please,
it's
you can hear
serious.
that it's not check, it's not good.
Oh, now it's like he's gone. He came back.
We've closed. Bye.
Oh, okay.
Oh, class rest, please help us with the recordings. We are begging you for.
You need only the recordings and not the slides.
Sisters,
Oh,
please,
if
the area.
If the slides would be possible to add, then they add it in. This time the baby can leave now.
Oh, okay. I'm still back then.
Hey.
Okay. Everybody can go. We can go. Okay. We can go. My network is jumping in and out of the Zoom. We are doing male and female and perfect. You say areas. Which areas?
Las Palmas.
Get the slides for today.
So how many questions, please?
I say you are doing 20 minutes or 30 minutes. So it means I'm not sure of the questions you will be doing. Okay.
Hey.
I'm using the random select system. Now, let me tell you one thing. The random select system does something. It's going to select the questions for you, actually. Okay. So that's why I've opened it for long hours, because each of you will get different set of questions. Simple as that.
Yeah.
So why do you think I don't care when you're going to do yours? I've opened it the whole hours, because it's just like your and it's not reshuffle. I'm not reshuffling anything. You are 900 students. I've loaded something like 10,000 questions. So you can select for everybody.
I know that.
Oh, so you thought you need somebody to do hairs, and then you go and watch and do.
Oh,
no,
no,
please.
Sir, no.
We don't
do that. We
and look,
Oh.
I've taught for so many years. Don't worry. Online, we started.
We are different, sir. Please, we are different.
About 7. I've already said to about 7 and one baby, okay. About 7 and appear.
It's okay. Those laughing places, please don't say things that
So, but make sure you solve all the questions in the book in male, female, because all those questions are involved. So you can get any of them. If you're lucky, you can get questions. Your questions will be coming from one area or this or this. It's a mix, so the system will do it for you. Okay.
Oh, okay.
So I don't know what you get, because I've set question on purpose, male, female, everything. So it will pick randomly for everybody.
Wow.
Okay. So that's why I've opened it all these hours. I can't even open the whole day if you want.
That's why.
The time should be extended a bit, like the 20 minutes or 30 minutes for us.
Oh, it means that I don't want you to do more questions. That's a few questions and go. Oh, are there any exams here? It will be now called baby. It will be.
So what about the questions at the back of the book?
Where was taking? Where were you?
Go and solve it.
So go and solve all, and then let's see what will happen. But please, the best thing is having it in your brain. Because if it's 20 questions, your time is the invigilator, not me. Okay? So I can open it the whole day, even 2 days. I don't care, because if I give you 3 options, 3 chances, anytime you enter, the system will pick different question for you. Okay? So
please,
I just
have
want to know who you are. And yes, the Macanua, Uber lectures, they be away Macanua. Book no to be solve questions. See, yeah, try it me be a few. I say, every page, is the annual day. Ah, oh,
sir, please, I have a
question.
Just go on. Sir, please, my own was on
yes, my dear.
IVF.
Go on, so that I can go.
IVF
I have
last
another
week,
lecture.
but the class ended. There's a woman who went for the IVF, even though she was about 40 years. She bled to the extent that she has to go and remove the embryo. And after
before they will do it for her, they will check her AMH. If she has the follicles are still good, age is nothing. They will do it for her. As for uterus, if the uterus is even dead, we can reckon. Okay, so that's why I was saying that now the uterus you can rekindle the uterus, so there's no problem. So now if you're 50 years and you have follicles that are viable.
So after the implantation, she bled. They went and removed the thing, but yesterday she bled till she passed away. So I don't know. Was it that her system was not good? She passed. She has passed on.
Oh no. Wait there, wait center before I start answering that question.
Oh, say it didn't happen in any center though. Like she was related to me in some way, like extended distance.
Okay, fine. So I can explain what happened. I don't want any trouble. Okay.
So, sir, please, the questions are there diagrams?
Allow her to explain.
Mandia, let me explain your question to you. You see, before implantation happens, we said that the endometrium thickness is important, and the implanted embryo aims at one thing. The syncytial needs to go to the maternal blood, so to go deep. So for that woman, it means clearly that the endometrial thickness was not achieved. Before you do you do implantation, you have to check and see that the endometrium thickness is above this. Because artificial is not like natural. Because if it doesn't reach and you give, the person will bleed because that embryo, that fertilized one, is very strong. So it will penetrate deep. And it means that they attach themselves deep into the blood vessels and they went to the basal layer. So she can bleed to death.
Oh, okay, sir. Thank you. Okay.
I hope you didn't take the case to court, did you?
Sir, please, she's still, they've not buried her yet. So, I don't know whether.
Oh, so it has put fear in you when it comes to IVF. No, please. Don't put fear in people. It depends on, that's what I'm saying, that when you want to do IVF, get people who understand what they are doing. Some people have learned it, kakrebi or baby. Okay.
Okay, sir. Thank you.
Yes.
Sir,
Deborah, I hope it's related to one.
As she was bleeding, sister, I don't know when you uterus now for the woman to stay.
No, they removed the embryo,
She will bleed to death, my dear. There are certain things, you see, before we do IVF, we put you on heparin or aspirin. Aspirin is what? Anticoagulant. Okay, so the blood become very circular. So if you remember the implantation, the three levels, and the chemical reaction. So because you put that lady on that medication, stopping bleeding becomes difficult. Stopping bleeding becomes difficult. Because we put you on that so that your blood becomes lighter and everything will go smooth with the uterus. So stop it bleeding. How? So you have to do that right. Know exactly before you transfer. You go on plantation. Some people want quick money.
And please, another school of thought is saying that IVF, if the embryo is able to get to term,
Yes,
another side effect is
okay.
DIC.
I think my next lecture is almost time. So
yes, okay.
we meet again.
Can you give
next
us
week and look at the
directions to
other
your
part
work, please?
left. Please feel free to do the test. You see, taking part alone is enough. Do your best. Okay.
Are there diagrams?
You get dictionary BBA.
I so glory won.
Well, say, tell me, baby, if you are
Mpamucho, what's the time Ben will be away?
7.
7.
7.
Okay.
7 to 1.
7 to 1.
1 a.m.
1 a.m.
p.m.
1 p.m.
Okay, tomorrow.
Okay, so I'll send a recordings now. And I'm actually your colleagues living a recording in Pamuchawa.
Please, someone has already.
Hello, sisters. Maybe I can say evening 7 to. Hello, sisters. Maybe I say which of the 7 p.m. or
7 p.m. to 1 p.m.
Wow. Okay, thank you very much.
Mr. Mufi, me why? Me say a recordings no me pacho. On a Telegram page where my Anna say pacho you move recording.
Recording one
The only thing he said was that he will put the videos that we watch on it immediately after class.
Yo, but what about to him?
Telegram.
Oh, okay, yo. I mean, sure, that's why.
Sisters, please, when is syphilis treated in a pregnant woman? Can somebody help me?
Yeah.
So 10,000 questions.
It's on the page. Let's leave and type all your questions on the page so that we solve them together.
When is it tested?
Yes, please leave the page so that I can send the recording. I will now have to do a convert it. I beg you.
First trimester, when the woman come for registration and you are doing your PMTC, you do the syphilis too, because some of the PMTCT kits are combo kits. So you check for the HIV as well as the syphilis.
I'm not talking about the checking, no, the treatment.
It will commence when the woman is positive and confirm at the lab. They will start the treatment there.
Whether first trimester or second?
Yes.
From 20 weeks?
Yes.
From 20 weeks?
Yes. Some too, they don't even wait. When the client tests positive and confirmed by the lab, they start the treatment there, and then they will let the husband also come and do the test.
Okay.
Yes.
Okay.
And some of the doctors too, they will give the injection like every week for 3 weeks.
So meaning 3 times?
Yes.
The cephalozyme.
Benzatin.
Sorry, benzatin.
Yes.
So now they don't take the electromycin anymore.
No, so far, no, I've not been seeing them prescribing that one.
Oh, okay.
Benzatin or benzoate penicillin.
It's benzatin 4 mils on each buttocks.
Yes.
Oh, okay.
It's benzoate penicillin.
Yeah, penicillin.
It's benzoate penicillin. So every week for 3 weeks.
Yes. It's painful.
Okay. Thank you very much.
You start with the husband. When the husband also do the test, they start it together.
Yes, they started together, and
then you advise them to abstain from sex for that during the treatment.
Okay.
So when they take it for 3 weeks, it's okay.
Okay. Thank you.
Welcome.